Welcome to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey. And welcome, gentlemen. We have a special guest tonight. Dr. Krishnan is here. We have a special topic, and we went out of the wheelhouse a little bit.
Yeah.
But before we go ahead and dive into tonight's episode, we're just going to give a quick shout out to our sponsors, Virtua Orthopedics and Spine. They have you covered from underneath a dog walker's hip to yard work, back, and laptop wrist. They have a doc for that. So find the right specialist for you at virtua.org/ortho. So, Dr. Frey,
Yeah, man.
I'll toss it to you for our formal introduction, and we'll get tonight going.
Yeah. So, Dr. Krishnan is born in the Philadelphia area, born in Philly. Went to med school in New York, NICOM, out there on Long Island. Did his residency around here, UMDMJ Kennedy, which is now, I guess, gone through a couple of iterations, is now part of the Jefferson system.
Mm-hmm.
And it works in New Jersey urology. Huge urologic group around here. 30-something docs?
Mm-hmm. 31.
Yeah, 31 docs.
Oh, yeah.
Yeah. So it's a big group in the area serving the three hospital systems within this area, Virtua system, Jefferson system, and Spirit system. Do you guys cover anything else or no?
No, that's all. That's enough.
Yeah. That's enough. That is enough. And, we kind of had this strange crossroads, right? It's not often we get to go to a urologist, to bring a urologist on the show. Although you did bring up a really good topic for a near future date that we'll get into at a later date.
Yeah.
But yeah. So this time around, we want to talk about Alex Singleton.
Yeah.
Kind of a crazy story.
Situation,
Yeah,
right?
yeah.
And I think we touched on it briefly a few episodes ago just because it kind of came out and we were like, holy cow, this is wild that this even happened. Quick background, if you will. Alex Singleton's a linebacker from the Denver Broncos. He was on the Philadelphia Eagles too. So again, we bring
Always
it all
bring
back.
it home.
Always bring it home, but he was just playing like his usual NFL schedule, and then he was set up for a random drug test for the NFL. Yeah. He came back and failed the drug test. And from that, there was some speculation on what was going on. And then they did some further testing or whatever the case was. Yeah. And then it was released that he has testicular cancer. And then he played a game on Thursday night, back when the Broncos played the Raiders on Thursday night in the beginning of November. And then the following day, he had this cancer removed. He was out for about 3 weeks. Luckily for him, in a sense, it was Denver Broncos bye week was in there too, so he ended up only missing 2 games.
Oh, I didn't realize that.
And then now he's
that
back.
Helped. I didn't realize that.
Now he's back and playing, and they're
He
Broncos
missed one game total, right?
2 games.
Yeah. 2 games. I thought it was 1. Okay.
Yeah.
And let me remind you, that game he played before surgery he knocked it out of the park.
Yeah. Oh yeah.
He knocked it out of the park.
Yeah.
It was amazing.
But
and this is a guy who's about to have surgery the next morning.
Right. And I think
And lights it up.
And then at that time
lit
too,
it up.
Yeah.
And at the time of the game, I think him and a couple of close teammates knew.
Yeah.
And then the next day, I think that in a team meeting, I don't know who informed the team, but everyone kind of found out afterwards. So no one really knew what he was going through at the time. They just knew he wasn't there on Friday, and they're like, "What the heck happened?"
From his perspective, granted, there's a mental aspect to it, right? But from his perspective, he was in the same exact situation the week before.
Right.
Nothing was different. He just had knowledge of his condition at this particular point. So, I get that he can play and play well, but you're right. Knowing you're going to be in surgery the following morning and what they were doing.
I mean, that shows his attitude. He's dedicated to football.
Yeah.
He's dedicated to the Broncos.
Yeah.
And he gave it his 150% that night,
Yeah.
knowing that he was going to be out for the next, who knows, 3 weeks,
Right.
4 weeks. He didn't really know what to expect after surgery, but he did it. He went out there, he played.
Yeah.
He did some dance, some kind of special dance afterwards.
Is that right?
Nobody really understood. You know what I'm talking about, Brandon?
Yeah.
I actually did not know that.
Yeah, he did a special dance.
Yeah.
It went viral.
Yeah.
And then the NFL was like, oh, I don't know what this dance is, because nobody really knew about this diagnosis.
Sure.
And then the next day he had surgery. Finally, the team came to know about what was going on.
Right.
And they've only been supportive
Yeah.
of what's
They've been,
going
of course.
on.
Right.
The team, the NFL, everybody's been very supportive. So I
So
find it to be a great story for us to talk about.
And exactly that. It's perfect to talk about, right? Because it's a nice little launching pad for something that's kind of important and probably goes a little bit not talked about frequently enough, right?
Correct.
So first, before there's 100 questions we're going to get into here, but to get it started. So from a surgical standpoint, what is it exactly that they're doing in the surgery?
Yeah. So what happened was they found a mass on his testicle.
Right.
So normally when we identify a mass, we have to remove it. So the testicle has to be removed.
Right.
And that may sound like a crazy operation, right? It sounds like, wow, why would any
Sounds
man...
awful.
Yeah.
Sounds
Gonna be
absolutely awful, right? So how did Alex do it? How did he get through this? But actually, it's not as crazy as it sounds. So it's an outpatient procedure.
Yeah.
We do a number of them every month for the same reason. Masses that are found on the testicle that we need to figure out what to do, what's going on, that kind of thing.
Yeah.
So prior to the removal, they didn't know what it was. They had indication that it could be cancer. That was confirmed afterwards. So he had a simple outpatient procedure.
Yeah.
He recovered very well. And he played 2.5 weeks later.
Yeah.
Yeah.
So he recovered well. He followed all the instructions that were given to him.
Yeah.
And he conquered this. He totally conquered this.
So so in this scenario, it's basically like excisional biopsy, right? You're taking it out, and you're doing the testing on it, but really you're taking the whole thing out regardless.
Yeah, exactly. So
and it's not just a little mass that you're taking out; it's the actual testicle.
The whole testicle. Yeah. So from my understanding, he had a mass in the testicle, and he was not able to save the testicle, so the entire testicle was removed. He had a number of other tests that were also completed, like CAT scans of the chest, abdomen, stuff like that, to check his whole body. They were all negative, so they were all clean, so they didn't have any cancer anywhere else.
Right.
It was only in the testicle. This was found very early, and I think we should talk about how we found it.
Yeah, absolutely.
You know,
how did they find it?
Yeah. So it's routine in the NFL. They check everybody for performance-enhancing drugs. So with that, there's a number of lab tests that these guys go through, and one of them is HCG. So HCG commonly is checked when you're pregnant. So this is a hormone that goes up when you're pregnant. So women get this checked all the time during pregnancy. Men have it checked only if they have an indication of possible performance-enhancing drugs or testicular cancer.
Right.
So he had this routine blood test. So he walks in. He's not doing any drugs. He's just captain of the defense. You know, he's the guy.
Randomly
He's
selected.
the guy. Yeah. So he's selected to do this test. He walks in, it's mildly elevated. So he's like, what's going on here, man? Like, this is not my mojo, right? I'm the guy, right? I'm Alex Singleton.
Yeah, I don't do this.
Yeah, I don't do that stuff. Like, I'm the guy, right? So anyway, they check it again. It's slightly elevated. He's not doing any drugs, right?
Yeah.
So they look at other causes. So they send him to get an ultrasound of his testicles. So that's a simple test, non-invasive, quick test. They checked his testicles. He had a mass. And there's the story.
Right.
Yeah.
Typically, though, if you are testing or checking for this, now in this particular scenario, it's just the forces involved here, right? He got randomly selected for testing for performance enhancing drugs, and they happen to notice that those levels are high. So and he's adamant, listen, I'm not doing this, and so then that led to further testing. Typically, would you screen or check with blood testing, or typically is the screening test ultrasound?
That's a great question. So that's the great question there, Steve. So how do we detect this? So what we recommend, so any male between the age of 13 and higher, 13 to 35, so that's basically the highest risk category.
Range.
That's the target range.
Okay.
Should be doing monthly self-testicular exams.
Yeah.
Okay. So this is a quick exam in the shower.
Yeah.
You get to know your testicles. You got to get to know your balls.
Yeah.
And that's what it's about. And
this is an easy thing to really run with and make a lot of jokes about.
Very simple.
Especially with your 13-year-old there in the shower.
Right.
So this is they're at the highest risk category for testicular cancer. It's the number one cancer among men between the age of 13 and 35.
Right.
So monthly self-testicular examination. I can't hammer it home more than that.
And I felt like when this happened, this is one of the driving points that makes this show worthwhile. Like this is one of the reasons why you got to do the show. It's outside of the territory of kind of our standard sports show,
right? But
it does follow the same format. It happened to an athlete. We're talking about his quote unquote injury. And we've gone down this road before, and a lot of good comes from this. people learn from it, the screening, right?
Right.
Just to catch it early.
Yeah, and so there's a month dedicated for testicular cancer, but I don't think a month is all enough. I think
Right.
we need to talk about this as much as we can.
Yeah.
Because when caught early,
Yeah.
the survival is over 95%. So
Yeah.
essentially, once Alex Singleton has further checkup, he's not going to have any problem. He's going to live his entire life. He's going to have a full career in the NFL.
Right.
And he's going to be cured
Yeah.
from this
Right.
just from the simple blood test or a simple self-examination that you
Right.
do every month.
Yeah.
And we see it in our office all the time in our practice. It's very curable,
Right.
very treatable.
And I think with that said too, is like I think he took that approach after like, you know, obviously it just was a whirlwind for him, right? And then he took the approach of like, I want to kind of, not that he had, it's kind of weird, right? He wanted to kind of go out in public about it to make this standpoint of like for men's health and to like, no, like this is something that happened. And, you know, I just looked it up too. He's in that window. He's 32 years old, right?
He's
It's
32.
like, and he took the stance of like, no, let's kind of advocate for this and, you know, make sure that more people know about it. And then again, start the conversation. And then here we are talking about it.
So, Brandon, that's a great point. So I want to talk about that for a minute.
Sure.
So I really like how celebrities and athletes get out there with their diagnosis. So we saw that with Deion Sanders recently. We see that now with Alex. We see that with a number of other celebrities. So they go through these serious medical conditions, and they're willing to share their entire life about it.
Right.
So Alex has shared everything
Right.
online regarding his diagnosis and
Yeah.
how it was found, what he's going through,
Right.
how it's impacting his family. And I think that's great. This is the stuff that we need. And
Yeah.
I think they're relating to our generation, to
Right.
us, to the people within that category who need to be aware. These
Right.
are the people who are not going to the doctor, right? They're working, they're online, they're not going to the doctor, right?
Yeah.
Because they're not sick.
In general, there are very
Right?
few
There-
risks, right?
there's-
Like, yeah.
So
generally
nobody,
pretty healthy.
generally, these are healthy individuals, and so when they see that on social media, this is an impetus for them to take their health into their own hands. And I think you bring up a great point with
Right.
these guys going online directly
Right.
and talking to us about what they're going through.
And they don't need to, right? Like
They
it's
don't have
totally
to do that.
their
This is a personal
privacy, it's
choice.
their
Right,
world,
and I mean,
right,
we
right,
say it all the time, right? We don't have access to Alex Singleton's chart, right?
Nope.
Like,
No.
we have access to his Twitter account though, where
We
he
don't
posted
need
everything.
it.
You know what I mean?
We don't
Like,
need it anymore
Right.
because we know everything
Right.
about it.
He's
And I
very
think
upfront about it.
someone of this caliber, for a high caliber athlete, if you will, hasn't been in the mainstream media for something like this probably since like Lance Armstrong, right?
Right.
And that was
Well, that was another big one.
And
that
that
Yeah.
was a
good-
big one.
Yeah.
that was, you know, but that was a decent amount of time ago where
Yeah.
it's kind of skipped a generation, if you will, and now this generation is going to help, you know, maybe be more with the Alex Singleton case and kind of understand it a little bit more.
Well, testicular cancer is nice because this is that age group, right?
Right.
So this is the age group. These are the people watching football every day, right?
That's true.
These are, right.
It's
Yeah.
a perfect,
So
yeah,
this
yeah.
is the age group that
That's-
we need to
yeah.
talk about.
Yeah.
Yeah.
And that age group, right? 13, especially 13 to, 30, 35.
Yeah, 35, 40, yeah.
The older half of that age group may remember Lance. The younger half of that age group,
They don't know
no
who
idea
he
who
is.
that
No
guy
idea.
is.
No
None.
idea.
Yeah,
No
yeah.
idea.
Of course. Are there other potential warning signs? Is it painful? Is
Yeah.
like the-
yeah. So that's a very good question. So what can happen? So if you don't feel a mass, but if you have other symptoms such as pain in the groin area,
Yeah.
pain outside of your testicles, or
Yeah.
pain around the area, or
Yeah.
even swelling
Yeah.
of the scrotum, that's
Yeah.
your testicle area. All of that needs to be checked out immediately.
What
Same
about
thing,
into your
quick
belly,
ultrasound.
into your gut at all?
Yeah, if you have a little bit of abdominal pain,
Yeah.
anything that doesn't seem right. So the idea is get to know your body, right?
Right.
Get to know what you normally feel like, and if anything is different, that needs to be checked out by a doctor right away, right?
Yeah, I think that's part of the reason why we're talking about this too. Is just like he was kind of unaware of anything at that
Right.
point, and then
Yeah.
if you will, he kind of got lucky that he was randomly selected for the NFL drug test,
Yeah.
right? And then
We've had a few of these shows where people get lucky, right? Like they've been traded, they're going
Yeah.
through the physical,
Yep.
whatever it is, and then something gets picked up and saves their life. Like it's
Yeah. Absolutely.
like we mentioned the John Darrenboss
Exactly.
situation when he was a long snapper for the Eagles, got traded
Right.
to the Saints.
yeah,
They found, I think, it was a cardiac issue or something along those lines, and saved
Yeah.
that guy's life as well.
right. Right. Exactly. Is there more than one kind of testicular cancer?
There are two main types.
Yeah.
So there are two main types. Fortunately, both of them have excellent survival. Meaning,
Okay.
If caught early, very well treated and even curable. So
And same
both
target
types.
age group for both of those
Same.
types.
Yeah.
Yeah.
Absolutely. Yeah.
Yeah. Now, treatment-wise, we just talked about it, right? Like typically removal, right? Like if there's a suspicion, we're worried, there's a mass, whatnot, remove it. Is there additional treatment, or
Yeah.
if they catch it early, and then how is it
Yeah,
different if they
yeah.
catch it early versus later or whatnot?
Yeah, so that's a very good question too. So it caught early, removal of the testicle, and I want to back up a little bit. So guys are like, what does that mean? Like,
Right.
what if I have my nut removed, right?
What?
Like, what?
Well, then
what does
what?
that mean? Right? So
Because I don't
got
want
two
that.
nuts.
Yeah.
I never asked for these two nuts. I
Yeah.
got two nuts.
Yeah.
Right?
Yeah.
What do I do? Like, if I lose one,
Yeah.
is the other nut okay?
Right.
Right.
Like,
Yeah.
do I only need one nut?
Right.
Do I
Right.
need half a nut?
Right.
Like, what is
What's
the
enough?
deal?
Right.
What's the deal? Right. So, what do testicle? And we're gonna get to the.
Sure. Yeah. No. Please do. This
We'll
is
get to
great.
it, Steve. So, what do nuts do? What
Yeah.
do they do? So,
Yeah.
they produce testosterone,
Right.
and they're involved in fertility.
Yeah.
Okay. So it's very simple, right? Two things that men are accountable for, right?
Yeah.
In this life,
Yeah.
right? So-
And very proud of, usually.
proud and accountable. Proud
Right.
and accountable, right? So you don't need two testicles to accomplish either one of those things. So
Right.
that's the greatest thing about having two. So
Right.
you can lose one,
Yeah.
and your testosterone level can be completely normal, and your fertility
Redundancy.
can be yes,
Right.
yes,
Just in
redundancy.
case.
There's
Yeah.
so
We'll give you
much.
another.
There's so much. So
Yeah.
there's so much there, right? So there's so much. So feel like a man, right?
Right.
So you can continue to feel like a man even
Right.
when you have one nut. So, but your friends may make fun of you as
Right.
the one nut guy. But
Once you're okay,
Right.
then they'll
then they'll
unload.
make
Yeah,
fun of you.
right.
So anyway, so basically testosterone fertility. So testosterone levels, a lot of times we check this stuff beforehand, so we make sure that everything's okay prior. And then usually the case is that your testosterone remains normal.
Does it really?
It
so
does.
there's no supplementation or no.
No.
Yeah.
If you need supplementation,
Yeah,
it can
they
be
do it.
given, but
Yeah.
you don't need it. So typically you don't need it.
Okay.
And then the second thing is fertility. So fertility, if there's an issue with fertility, we do say that you should consider banking your sperm. So
Yeah.
you can bank your sperm
Yeah.
prior to having one of your testicles removed, just in case.
Right.
It's not you don't have to do it.
Yeah.
You can do it.
Yeah.
And Virtua offers some of that stuff too. So that's nice. That's a little plug.
Excellent
Yeah,
point.
yeah,
Yeah. Well done. Well done.
There you
Well
go.
said.
For our sponsor, great
Right.
sponsor. So anyway,
Yeah.
so we do offer sperm banking if you need to have it done.
All right.
Okay. But other than that, yeah, there's really no other reason. So you don't need a testicle.
Right.
So we offer that. Now let's talk about early detection versus late detection.
Yes.
So when it's caught early, very well treated. Late detection, so that's when you're going to have a little more of that abdominal pain. You may
Right.
have back pain. This may have indicated a spread of the testicular cancer.
worrisome.
So then sometimes you have to do chemotherapy or radiation. So then
Sure.
it becomes a little bit more involved, but still very well treated. Yeah, so you do very well. The treatment is a little more intense,
Right.
Yeah.
but you still do really well. So at the end, the outcome is usually pretty good.
Yeah. They wouldn't typically do. I keep saying they, but it really should be you, right? Like they
Yeah, us,
would.
yeah.
Wouldn't typically do chemo if regardless as like a safe bet or just to be sure, kind of a careful thing.
Yeah, you
Typically,
don't-
like if it's
yeah.
early and we get it and there are no other signs, like you're good.
You don't need
have to sweat
anything
it.
else.
Yeah.
We just do a lot of surveillance. So surveillance means that we continue to follow
Right.
the cancer, make sure that you remain cancer free, probably for the rest of your life. So
Yeah.
and that involves some scans and doctor's visits and good stuff. You become really good friends with your urologist. after
Sure.
that.
Right.
Yeah,
right,
yeah.
right.
Yeah, you even go have a beer
Yeah.
with him afterwards.
I would say the
I'm
good
like,
news
"Us
is
here today."
typically if if you got to hang out with a doc, your urologist is probably the guy you want to hang out with. Like,
Yeah.
they got to have a sense of humor.
Oh
is
yeah.
what
If
basically
you're
what
ever
this-
at a
right.
cocktail party,
Yeah.
you want to find
That's who you want to
a
find.
urologist
Yeah, yeah.
or a colorectal
Surgeon.
surgeon. Yeah. So those are the two guys.
Yeah. Because
Because
they deal with some stuff. that
what
needs-
they
you need humor.
find
Yeah.
is an entire night of a conversation. What they found.
Right.
A colorectal surgeon.
Oh,
That's
yeah.
the guy at a cocktail party. That's the guy you want to sit next to.
Yeah.
Right. Oh man, holy cow.
So, so I guess in that regard too. So for Alex's case, he'll be having regular follow-ups as he goes along, and I'm sure that's going to just be something that's added kind of to his annual physical for whatever team takes him on or whatever the case is. And I'm sure at this rate he may have a guy or a urologist that he's going to be.
Yeah, so that's good that you bring him up. So his urologist, so he actually named his urologist, his whole team.
Oh, okay.
In his Twitter, so he actually gave a shout out. So I want to give a shout out to his urologist too. He did a great job. He did exactly what you need to do. He scheduled surgery not immediately, like Mahomes.
Right.
And which we'll talk
get into
about.
that.
He said, listen, we're working you up. We're going to get a CAT scan. Go play your game.
Yeah.
There's nothing wrong with you.
Yeah.
Like, go play your game. We're going to take care of this.
Yeah. Yeah.
Go play
Yeah.
and knock it out of the park like he did.
Yeah.
And then I'm going to schedule your surgery. So he scheduled it in a timely manner, which is exactly what we do in real life.
But that also, not to be misconstrued, that doesn't mean ignore it. You got plenty of time.
No.
That just
He
means-
scheduled them within a week.
Yeah,
It was
exactly.
within 1 week,
Yeah.
which is exactly what I would do in my schedule. I
Right.
would say 1 to 2 weeks.
Yeah.
Let's get the testing that you needed. So Alex got the CAT scans and everything that he needed before surgery,
Right.
which is exactly what I would try to do.
Yeah.
And then I would schedule surgery. So his urologist did everything according to what we would do with anybody. So anybody who came into our office. So he did that, and then he did a great surgery because he recovered.
Right.
He had no post-operative issues whatsoever.
Right.
And he's back on the field.
Yeah.
So what would like that seems fat? Well, I guess we could look at it two ways. And one part of me says like, well, it's just soft tissue. What took you so long?
Right.
But in reality,
I
like,
normally give him 2 weeks.
Yeah, I was gonna say, what is the standard
typically it's
recovery?
about 2 weeks.
Yeah.
2 weeks, jock strap.
Yeah.
And my joke is you make love to a bag of frozen peas.
Right.
So your
You got that
frozen
buddy for a while.
peas are
Living
stuck
there.
to your groin for a while.
Yeah.
I mean, and that helps your recovery. That kind of stuff is what takes
Yeah.
care of your recovery.
were there any risks for him? I guess it would be more just like incisional risks or having a complication.
Yeah, I
with
mean,
that.
so
Is
there's
there-
no really hernia risk. The only thing would
that's
be
where I was
like a
going.
hematoma or something
Right.
like that, which is a collection of blood. Things can happen.
Sure.
I mean, he took it easy. He put on his Twitter. He's like, I can't believe I'm jumping up and down right now,
Right.
cheering for the Broncos,
Yeah.
Right.
and I'm supposed to be laying in bed.
Yeah.
So I don't get a hematoma.
Right.
Crazy.
So
So,
crazy story. Yeah.
so I guess a question would be, a guy like Alex Singleton's pretty straightforward. He does all the right things. Flip the script of someone who isn't doing all the right things and is, and taking on performance enhancing drugs or doing, HGH or extra testosterone. Does that put them at a higher risk for something like this because they're supplementing or they're trying to take, away the job of the testicles, like you mentioned?
Yeah.
Like they're getting supplemental testosterone from elsewhere. Does that put them at a higher risk for something like this
So
happening?
funny thing you mentioned that, Brandon. So the use of marijuana actually increases your risk of testicular cancer.
Really?
Yeah. So it's a very
That's a strange
slight-
connection.
It's a very slight risk.
Yeah.
But it does increase your risk.
Similar. Does cigarettes increase your risk of testicular
The
cancer?
cigarettes do
They do not,
No,
but marijuana
cigarettes
does.
don't, but marijuana does. Yeah.
Interesting.
It's a very slight risk.
Yeah.
It's a crazy little fact.
Sure.
Yeah.
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 Something worth throwing out there. Something
But
to
the
know.
guys doing the other performance enhancing drugs now, they don't have any.
No, not an increased risk.
No.
What about people who are
They have other problems.
Right.
right. So I guess
Like guys who drink Monster have really small testicles.
right. Oh man.
They're probably going to cut that part out.
No, not necessarily.
No, it's all right.
The so I was actually about to go right down that road, right? Like, so there's a lot of stuff that's not testosterone that's pretty much almost testosterone, right? Like
Yeah.
a precursor that's there. You know, you get it.
Yeah, DHEA.
Yeah. You get any nutrition store, vitamin supplement, whatnot. Does that doesn't increase your risk either? And
So what it does is, all of those drugs, if they have some type of precursor to testosterone,
that's right.
it's blocking the pathway of your own natural testosterone.
Right.
So what's that going to do? So overall, over time, it shrinks your own testicles.
Because they don't have to do the work anymore.
Right, they
Just
don't do the work
atrophy,
anymore,
kind of,
so
yeah,
they
right.
atrophy,
Yeah.
right? So Brandon's using fancy medical terms
Right.
for small balls. So they become
Right.
small balls. So they become tiny little peanuts.
Yeah.
because they don't have to work anymore.
Right.
Yeah.
And then the problem is later when you go off of
Yeah.
the supplements,
Yeah.
you have nothing.
They don't kick back in.
No.
So
no.
once you're on it, once you're using
Right,
it,
they went on vacation and they never came back.
right.
Yeah.
They went on vacation and they never came back.
And that's it.
Yeah.
I hit the road. Yeah.
So
that's a problem. That's why we
That's
say
a real
use
big
with
problem.
caution. Yeah.
and I think that's a huge problem for this age group.
Yeah,
again, same thing.
absolutely.
We're like people are like, I want to get bigger. I want to get built. I want to put on
Right.
muscle. I want to do this. I want to do all these different things that testosterone can help you do. And they lots of times they probably don't realize they're essentially taking testosterone. They're just doing it, like
Yeah.
you said, as a precursor.
Right.
And there are these downstream sequelae, these other
Absolutely.
issues that are going to be real. First, there are issues associated with taking it, like some risk factors right off the bat, but then down the line,
Mm-hmm.
these other major issues.
You will have major problems.
Right.
Yeah.
Right.
You got to use your own body's natural testosterone.
Right.
Yeah.
Yeah.
And
Don't
that
supplement.
comes from your testicles.
Right,
Yeah.
right. Now, what about the other end of the spectrum? You see people who are taking similar type supplements. They're 40, they're 50, they're whatnot, and it's being sold, this is something your body naturally makes and it's no longer making, and then they're taking them. Are there any issues for those individuals who then start taking the
Yeah,
same
so
things?
most of the time they're overweight individuals with obesity. So what happens is a lot of their body's natural testosterone is converted to estrogen,
Got it.
which is then metabolized through their fat cells. So, I mean, this is a whole podcast.
Right. Yeah.
But essentially, what we do is we make a program, a contract. So weight loss, a little bit of testosterone replacement, and then sometimes now these GLP drugs, right?
Right.
So now we're making a contract with the primary care doctor, the patient, and us, and we put them on a short term, maybe a year, 2 years. And then they get the weight loss that's desired.
Right.
And then because it's such a short period of time, their natural testosterone is still working.
It didn't completely
And
turn off.
No,
on them.
no, absolutely not. Because we're calculating. These are dose calculated regimens,
Sure.
Right.
labs every 3 months.
Right.
A lot of patient visits. I mean, this is like a contractual agreement that
Right.
we're getting into. And I think patients do a lot better with that long term,
Right.
keeping the weight off and feeling better
Right.
and increasing their sex drive.
And
That's what testosterone's all about.
Right.
Right. And one of the knocks on the GLP drugs is that you do lose muscle mass. Like you
Yeah,
gotta work out.
absolutely.
You gotta.
Yeah,
And
you gotta
so I
work
guess
out.
the testosterone can help counter that a
It'll
little bit
counter
during
that
that
a little
process.
bit. Yeah, but they have to work out.
Right.
Yeah, that's a great point, Steve. Yeah, they have to work out because muscle mass is gone.
Right. Are there other risk factors? You just said marijuana technically is a very small risk factor. Testosterone, albeit its own whole set of issues, is not a risk factor. Is there a family history?
Yeah, so
is it,
there's
or other
family
risk factors?
history and then the history of an undescended testicle.
I was
So
going to
what
go
does
there.
that mean?
Yeah,
So
I
what does
remember that
mean?
from med school
Yeah,
way back
so
when.
what
Yeah.
does that mean? Everything. What does that mean? So our testicles are actually formed by our kidneys.
Yeah.
Like that's where they are in utero. They're formed up by our kidneys.
Growing them
And then
in the kidneys.
Yep, they grow right next to the kidneys when you're an embryo. So
Yeah.
when you're a baby inside your mother's belly,
Yeah.
the testicles are formed up by your kidneys,
Yeah.
and then they drop down through the
Yeah.
course of your development.
Yeah.
And then they ultimately leave the body and go into the testicular sac.
Yeah.
So what
Their own
happens
little
is
pouch.
some people, it does not go all the way down into the sac.
Right.
And it stops maybe 3/4 of the way.
Right.
And that's a risk for testicular cancer. And the number 2 thing with that is you can't feel it.
Right.
So you wouldn't be able to know
Right.
if you have a mass that develops, so you wouldn't be able to feel it, right? When our nuts, we can feel our nuts all the time.
So right
Some
there.
people
Yeah.
feel them all day long,
Yeah.
right? You see that, right? We're only saying
easy.
once a month. We're only
Right.
saying once a month. But some people touch them all day, right?
Right. So
But-
go ahead.
Yeah, so basically, whenever we have an undescended testicle, we take it out.
That's right. So if you have an undescended testicle, you know it because there's only one testicle in your scrotum. And then two, like you said, like they take it. I don't know why I was under the impression that they can bring it down, descend it for you. But
So that's only when you're a baby.
if you're a baby.
So when you're at birth, within the first 6 months, we can bring that testicle down and make sure that it stays down in its place. If it's not, and you go into your teenage adult lifehood, we have to take it out.
Then you take it out because of this, because of this risk.
Right.
Interesting.
Now, one thing we haven't talked about, we actually have prosthesis, testicular prosthesis.
Oh.
Do you know about this? Do you
I mean,
understand
I think I can figure
Steve,
it out.
Yeah, so very similar to breast implants,
Right.
there is a silicone implant that we place.
It's silicone.
It is a silicone implant, and
Interesting.
it will mimic a testicle.
So if you are taking one out, and then
so it's a complete physical
Yeah.
type of appearance. And
Right.
It's very nice. They're very nice. So this is something that we can talk to your urologist about.
Sure. If it goes in that direction.
Right.
Yeah.
All right. You have
if
an
you
option.
need to.
Yeah.
Right. I don't know what else.
I don't know. I think that's
This is
hitting
pretty
a bunch
good.
of the
Yeah,
major
we talked
stuff
a lot
in terms
about.
of like
We've gotten
testicular.
into maybe too many nuts.
Right.
Yeah.
Yeah, I mean, for the
covered
most,
every nut. Right,
for the most part, I mean, there's any other risk factors or lifestyle habits for athletes and in general, or whatever the case is. Is it like, I don't know, like anything else for anyone else to look out for, or you know, outside, like you mentioned, like self-exam is like the big one. Like get to know your body, figure it out, and do regular exams so you know any changes or difference. And then if you do notice, find a urologist and figure go that route.
Yeah.
I'll go off topic here since we got you here and go into something a little different, but I guess it's to some extent same at-risk group, probably a little bit younger to be honest with you, but an athletic population and whatnot, but would be testicular torsion.
Yeah.
Completely off topic, but how does that present? What should someone do if someone a kid drops on the field, like worried about that?
So torsion is a surgical
what is it?
emergency.
Yes.
Okay, so that's number one.
Yeah.
So if anybody,
I remember you opened it like a book.
yes,
Yeah,
absolutely.
yeah,
See, so
right.
Steve did learn something
I
in medical
remember all
school.
this
Instead of
stuff way back when.
partying,
Yeah,
instead
yeah,
of
yeah,
partying with his
yeah.
buddies,
Yeah.
he actually went to class. So you're right. So testicular torsion is very simple.
Yeah.
So typically the risk factors, you're born without a single attachment. So there's an attachment that holds the testicle in place.
Kind of an anchor.
Yeah, like an anchor. Yeah, it's
Right.
called the gubernaculum. So you probably, Brandon probably knew the name of that. He's the medical guy. So the gubernaculum is a small little attachment.
Yeah.
So if you're born without that, your testicle can actually rotate freely.
Yeah.
So if your testicle rotates into a position where it can't unrotate itself, it stops blood flow to itself.
Bad news.
Bad news. Surgical emergency. So testicular pain, young athlete, young anybody, young man needs to come to the emergency room immediately. So that's the first thing I would say, because you have a very short window where if the blood flow is lost to your testicle, you have to correct it immediately.
Right.
Or that
Losing the
testicle is
testicle.
going to be removed.
Yeah.
Yeah.
That testicle is going to be removed.
So the open it like a book is what you do when you're in
When
surgery.
you get inside,
You don't have someone trying to grab and do that from the outside. Then.
Yeah.
Okay.
We try to detours it, so
Yeah.
it can be it can be manually rotated or rotated back into a normal position. That doesn't happen very often, but it can be done.
Yeah. Okay.
Yeah.
Yeah, I mean that's definitely something we've learned when I was going through school. Of
course.
like what could happen on a field, or when
Right.
you have
Yeah.
those people come in, or whatever the case is. But good point. And again, something to note is that it's an emergency. You don't sit this one out and see how it feels in 24 hours,
Right.
like just to be
just
safe.
go home. Give me a call tomorrow.
Yeah.
You gotta no, because if you wait till the following day, you're
boat.
going to miss the boat.
Yeah.
And you're going
And
to
it
lose
could be
your testicle.
trauma related, like someone takes a hit.
Yeah, the trauma can be the
Induces.
inciting factor, but you've lost that
Yeah.
You didn't have that gubernaculum to begin with. Yeah.
To start, and
Yeah.
then that sent you down.
So
this
with
path.
that being said, too, so like direct trauma to the area could cause it in
It could
Spin.
cause a torsion
Yeah.
or a testicular rupture. A rupture is another one.
that doesn't sound good
I
at
know.
all.
No.
Yeah, that does not sound good at all. Yeah.
Because I mean, like it definitely does not sound good. But I mean, I think, in my career thus far, I've probably sent 2 or 3 athletes to the ER with testicular pain, or it was one of those situations where our doc was on campus like that day. And we're like, all right. And then it's like, hey, doc, I got something for you to look at. Like, and it was like, oh, whoa, what? Like, we're doing this right now? It's like, yeah, it's like one of those situations. But, I mean, even this football season alone, I probably had at least 5 guys who've gotten hit in the groin. It's like, all right, we'll give it a minute if it kind of calms down.
It's okay.
Yeah, like make sure everything's all
Well,
right.
they're wearing jock protectors. Right?
Yeah,
They're wearing protectors.
Most of the time, it's
Sometimes,
not the cool thing to
Maybe
do
not.
for sure. Like,
You have to have a protector.
yeah,
Yeah.
You have to protect your nuts.
Yeah.
and I think
They're
it's
prized possessions,
Yeah.
Brandon.
yeah, I know,
Yeah,
and I
prized
just don't
possessions.
think it's a common thing, and like in this generation, like I don't see it. I don't think I see enough people wear jock protection in general in sports nowadays.
Yeah, that's it.
Like,
I know.
think-
I've heard that
Yeah.
too. I've heard that.
Like
too.
I think when I played football, lacrosse, I always wore one. I played defense for lacrosse. I was like, I'm not trying to get hit
Heck
with
no.
a
You have to
lacrosse
have
ball.
it
Like,
on.
no thanks. A good friend of mine who I played high school with, he went his whole career without wearing one, and on his very last game, he paid the price.
Really?
It was like,
What did he have? A rupture?
No, he just got hit. Like, he
got
just took
hit.
a shot right into it, and he was in a lot of
That
pain.
God, it
but-
wasn't worse.
Right, but luckily nothing else happened of it. But I think across the board, outside of I think goalies, most people don't.
Yeah, they
like,
Well, I would protect the family jewels.
Right.
man.
Yeah.
Right.
Protect them.
There's a lot on the line.
Yeah.
yeah.
Yeah. One of the other pretty impactful, kind of crazy injuries we wanted to talk a little bit about today would be TJ Watt.
Oh yeah.
Oh,
Yeah, we're gonna
man.
shift here.
Yeah.
Yeah,
This is-
to a little bit of a shift.
Are we
but-
done talking about nuts?
I think
I think
today, for today.
for today,
Yeah,
for sure.
We can come back to the topic. but-
Yeah.
Come back.
But I think it wouldn't be our show if we didn't kind of go over this past week in the NFL, where
I
a
think so,
lot of
yeah.
big people went down with a lot of various things.
Yeah.
Even before Sunday hit, and I think it's a good way to start and to talk about TJ Watt, who was early reported that TJ Watt's gone to the hospital for a lung injury.
Right.
It's kind of how it started, and then more details kind of came out.
It was very, very weird.
Yeah, and then
Cryptic, yeah.
his brother JJ Watt went to Twitter, and again, the beauty of social media, right, and kind of detailed some more that he was getting a dry needling treatment. Ended up having a lung issue, and then he went to the hospital, had surgery, and now he's out for a little bit of time here.
Yeah.
I didn't realize how common dry needling was until I heard about this. Yeah.
Right.
I mean, I'm kind of like, I don't look into dry needling a lot, but this is pretty
Not
common.
in urology, probably.
Yeah,
not.
not in urology. No.
But yeah, and oftentimes it's done by physical therapists. There are definitely some docs that do it. Like, I don't fully understand like what is happening, like what the benefits that's creating. My thought is usually that one, you're breaking up kind of like adhesions and calcifications and whatnot, and then two, kind of bringing blood flow into the area. And correct me if I'm wrong, if there is more to it.
So I won't speak too much on it because, I mean, athletic trainers can dry needle.
Yeah.
Unfortunately, we can't in New Jersey, so I don't. I haven't taken any classes on it.
Sure.
I've seen it a little bit clinically in my practice, with other physician or physical therapists or whatnot.
Yeah.
And I mean, it does great with, like a physical, like getting inside the muscle
Yeah.
usually.
Yeah.
But, I've seen it on like nice meaty thighs where it's
Yeah.
like there's no organs underneath there.
Yeah.
You're not going to like stab something like crazy or whatever the case is.
And I've seen it work really, really well. I even saw a scenario, someone had frozen shoulder, and I said, listen, you can dry if you want. Like, I don't think there's a lot of downside, but I just don't think it's going to help. And it did. And
Yeah.
I was very, very surprised, but it made a dramatic difference. And someone that was really stuck.
I have a question for Brendan. So, is it similar to acupuncture? Is it derived from? This is just ignorance.
Yeah, I
of
think
me.
it's
Sure.
like,
I,
and again,
I can ask questions.
Yeah.
Yeah.
No, please do. Yeah.
No, I think it's very similar. I think the philosophy behind it's a little different.
Yeah.
and again, I could be very much wrong on this, but I think acupuncture is more like based off like
Lines of
like
chi.
lines of chi, meridian
Yeah.
patterns and stuff.
But
like
who knows? Maybe they were doing the same thing.
yeah,
Maybe
honestly,
they were breaking up the
right.
same.
Yeah.
When I think
That's right.
about it, I don't because you don't know what
Pressure
those
points
guys
or-
were
yeah.
thinking about
Yeah.
back then.
and like it's all kind of the same, but I've seen it a lot where like it just kind of like I've been dry needled once, and I was having dizzy spells. I just weirdest scenario, and I was dry needled in my ear to kind of stimulate my vagus nerve to kind of like do it, and it worked. So like a couple days later, I didn't have this crazy dizzy situation happening. But I've seen it clinically where it's like you have some quad pain or something, and you just find these muscle like these trigger points, and you get the needle in there. You do it, and then sometimes they even they connect it to electric stimulation. They stimulate the muscle like intramuscular, and it just works a little bit better than all the external stuff of like instrument-assisted soft tissue mobilization or even like cupping or all that stuff. But just to get in there and you kind of work it, and you just kind of let it kind of deal with it, and you see it when you go, and sometimes the muscle really twitch really hard, and then after a little bit of time, you just see it kind of relax and other things like that.
I will say, like, there are times when you do injections and you can feel that crunchiness. Like, you can feel, like, like, and we'll do, like, ultrasound guided injections, like, let's say, rotator cuff one. And they're, like, I'll do for, calcific tendonitis. When someone has calcific tendonitis, like, it's very clear. Like,
Yeah, you feel it right away. Yeah.
absolutely.
Yeah.
But even in scenarios sometimes where they don't, it's the tissue is just, there are little adhesions or whatever it is, but, like, you can feel sometimes that crunchiness, which I don't know for sure, right? Like, but I think that's what you're breaking up a lot of times when you're doing the dry needling.
I think it's nice. It sounds like
Right.
great. It's non-pharmacologic.
Yeah.
So you're not putting anything in your body.
Right.
You're just letting your body kind of break up scar and then
And I
Jump
think,
starting the healing process.
Yeah,
like that
jumpstart
micro
healing.
inflammation,
Yeah,
like just
why
starting
not?
a little bit of inflammation, and like, hey, body, work at this area.
Clean it up.
Figure it out, clean it up, get the stuff going in the right direction.
However,
However, back to
When
our
you're
friend.
when you're over any of the big major organs,
you don't want to go into the lungs with this stuff.
Right.
Like,
Yeah.
and you got to imagine very clearly that wasn't the intent. So, like, I don't know all the details here, but I do. The Steelers had played. The Baltimore the week
They
before,
played
right?
the Ravens, yeah.
And I'm pretty sure T.J. Watt stayed in Baltimore an extra day. I think he'd gone to the hospital that night with something going on, like with some pain, or he didn't feel right or something or other. And in the back of my mind, I was like, I wonder if he has like a PE or like this is weird. And actually, I wonder, like, did he have a pneumo? Did something happen, right?
Right.
And then he went home, and then he's getting this procedure, and I'm guessing the procedure had to do with whatever it was.
right?
That was chest pain, rib pain, something or other. That's what they were doing when
So you think
whoever
it
did it.
happened before? You think it happened?
No,
during the
I
game?
think he was
No.
getting the dry needling as a byproduct
Yeah.
of whatever,
Whatever
it was
it
that
caused
kept him
it
there.
in that
Yeah.
game.
He moved when the needle went in.
Yeah,
He's like,
sneezed.
oh,
You know,
he moved. He
Who
sneezed.
knows? Like, I've been in that scenario where someone's like, "Whoa!"
Yeah,
you know,
move,
you're like-
right? Because they're awake,
Right,
right? When
right.
you're
Yeah,
this is happening when you're awake.
Yes, they are. Yeah,
So
yeah.
he may have moved.
Yeah, he could. I mean, and I think with this too is like we when you and I were texting about this too.
It sounds ridiculous, but that is a legit point. He
I would
might
think so
have moved.
because if,
Sorry, I didn't mean to cut
you're
you
No.
off.
up by the shoulder,
Yeah.
it's
No,
fair
I mean-
game.
Right.
It's fair game.
No, because I've seen it. When certain people get it, they're like, "Oh," they kind of like flinch a little bit. It's like, no,
Sure.
you got to let it relax. Like, let
Yeah.
it kind of do its job.
Yeah.
And I mean, we've seen. I guess I don't know how to like a pneumothorax happen after treatment. Previously, a couple years ago,
Tyrod
with
Taylor.
Yeah,
Tyrod
Tyrod
Taylor
Taylor.
went down.
Yeah.
I think he was getting an injection though in his
Yeah.
like a rib or something,
Which
And
I
then-
don't understand.
Which
but yeah.
whatever the case
Well, he
was,
had costochondritis or
Yeah.
something
Yeah.
like that, right?
Yeah,
And
right.
they were doing a steroid injection.
Yeah, and then-
Just surprising.
then he goes down for the
Course of
Chargers, and
treatment.
then Herbert starts, and then the rest is history. And Tyrod
Tyrod on
goes-
another team.
goes
He's
right.
gone. Yeah.
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 Herbert is amazing.
Yeah,
right. That's the last guy you want stepping in to,
right. To take over when
right.
you had the opportunity.
because
to
your
start
job is now gone.
right.
But yeah. So you can imagine, as a Steeler fan, I'm like, oh, for the love of God, I'm really happy. They played really well last night.
Yeah, they did.
Yeah.
The defense looked really good.
Even without him, is impressive, right? Like
Shocking. Yeah. Because I feel like he's a core part. I mean, he's a great player. Right? He's a core
Right.
part of that defense.
He's a core part of
Yeah.
it.
And then and he's fast. That's one of the things. He's fast.
Mm-hmm.
He's strong, but he's fast. And Miami is just speed all around. It's
Yeah.
a very very fast team. So yeah, I was super
When do you
excited
think he'll
about
be
that.
back? What's your estimation?
Right. So similarly, as as we were joking around a little bit about having surgery, removing his testicle, you just need soft tissues to heal. This is somewhat along those lines, right? Like getting the soft tissues to heal. You would like to think he'd come back soon, but on the flip side of that, right? If there is a problem, it could be a big problem, right? You could wind up with a tension pneumothorax or something or other. It could actually be life-threatening. So I don't think you rush him back. And I read reports that he might be back for this coming week. I would be surprised.
Yeah.
I think that this will be a 3 to 4 week.
Yeah.
It takes a little bit longer for this stuff to heal.
You want it to fully heal. The last thing you want to be is out on the field and something
even if
goes
you
awry.
gave him high pressure oxygen or something like that, you still want him to heal.
Right. So
all the way,
and they're playing Detroit this week, so it's a loss probably anyway. I hate to say it, they look really good. Yeah, I would love it if they pull it out somehow, but you know what? Let's save them for the stretch, kind of a thing.
Yeah, save him.
But for the most part, I mean, Mike Tomlin's still going to end up not without a losing season.
He has to get one more.
One more, right?
Yeah, one more win this season to make sure he doesn't have another losing.
One of the streaks that stays alive this year, right?
It's amazing. What's amazing, which I didn't even realize, but the Steelers haven't lost a Monday night game
in 23
years.
That's bonkers.
It's amazing.
Yeah,
that's their
crazy.
lucky night.
Yeah.
The stats they were putting up last night before the game of Miami's tied with the most Monday Night Football wins with San Francisco or something like that all time.
Yeah.
I think the Steelers are fourth, but they're on a 23 game Monday Night Football win streak.
Put that
all that stuff pre-game. I was
nuts.
Man, to have that job, all these stats is crazy. But all these stats are just actually wild that these teams just historically have done so well on Monday night or whatever the case.
How does that
I don't know
happen?
it doesn't make sense.
Right.
Yeah. They're all partying on Saturday night before the Sunday game.
I guess. I don't know. Yeah.
I don't know what it is on Sunday night. They're going to church and
right.
They're
praying for the win.
Right. Yeah. They're praying for the win. And then 2 other really big injuries.
Yeah,
right?
I think we would be not ourselves if we didn't talk about Patrick Mahomes and Micah Parsons both going down with ACL tears this weekend. I mean, Patrick Mahomes went down, and unfortunately the Chiefs also just went down this weekend, and they're out of the playoffs for the first time in over, 10, 11 years. Yeah, something crazy.
Not super upset about that part of the equation.
But, you lose
the
face of the NFL, if you will, of, Patrick Mahomes going down with an ACL. Suspected ACL tear the night of. That's what the first reports was.
Right.
And then
in fourth quarter. So they were already losing.
Yeah.
They were already losing. Let's not blame it on the injury.
Yeah.
It was probably over at that point. Yeah.
And then the crazy part with the Mahomes story is that, it's Tuesday. He played on Sunday, and his ACL is already repaired.
Yeah.
It's already reconstructed, and then it's also reported that he also had his LCL. Had an LCL tear and also was fixed.
Yeah.
All in the same surgery, but within 48 hours of injury, which is crazy.
Yeah. We were talking about that a little bit before we went on. So people who, when they come in with a torn ACL, are usually like, let's do it tomorrow. And lots of times they've lost a lot of motion. So they're pretty stiff, and oftentimes it's a 2-3 week sort of wait, get the physical therapy, do your prehab. You work on a little bit on strengthening, kind of wake your quad up going into it. But really the big thing that you're doing there is getting your range of motion back. If you do that surgery when someone's range of motion is poor, you're kind of dooming them to a stiff knee afterwards. So we really, really emphasize getting that motion back. And one of the jokes that goes around, and actually came from one of the board of review courses, is that over 14,000 feet seems to be the only place where you don't have to wait. And the knock on that being is that people go out to Colorado, they go skiing, they tear their ACL, they come home with already having the surgery done. They didn't wait at all. Of course, that's the home surgeon's problem to deal with, not the guy who did it and sent them home.
Yeah.
So a little bit of criticism, lighthearted criticism there. But now we have Mahomes, and he just got it in 2 days.
But this is a second opinion, though.
Yeah, and it's a second opinion.
Yeah.
Was that same sort of pressure? Hey, we got to do it. We got to do it.
Right? Yeah. What does that mean?
But that is not the norm. That is surprising. Like to think maybe, again, we don't have access to his medical charts. We don't know exactly what was going on. We don't truly know the details. We just know what's been released. But that there was no stiffness involved in this particular situation. Maybe it was exceedingly unstable, so they felt like they had to get in there really early because it was the combined injury, ACL, LCL. But even with the both of them, oftentimes you're waiting. You don't do it right away.
Or are they rushing to get him ready for?
Well, the
for
clock
next
doesn't
season?
start ticking until you have the surgery.
Right.
So maybe you want to do that to get it done as quickly as you can. But even with that, he's not 25. He's not 22, right? He's a little older in his career, but he has career
he's
left,
29,
right?
yeah.
Tom
Yeah.
Brady, I think, tore his
Same-
ACL.
same
age,
scenario.
right? And so there's a career afterwards here. The main goal is best result you can get, not save 2 months or a month or whatever it is going to
Right.
be. But you're right, that is one of the pressures, I'm sure. You do the math and you're looking at September-ish return.
He needs to come back, and he needs to be strong and ready, and physical therapy through, and he has to be ready to go. He's the face, like you said, Brad.
He's like the face.
He was the face.
Yeah.
This year, who knows what happened? I don't know. We could talk about that for hours. What
Yeah.
happened?
I was surprised. I was surprised they did it so quickly.
Yeah.
And again, I think with that idea of like, the 9-month timer starts, but that's like that 9-month timer is like with an isolated ACL reconstruction.
Good point.
Then you throw the
Might be looking
LCL
at
in
a
there,
year.
and now we're like, oh, that might be a little extra time. Maybe like talking 10, 11 months potentially. And again, and I think this always goes with, I think it's just overlooked with all surgeries and all things. That's without any complications at all.
Of course.
Yeah.
You know,
and
like-
you could do everything right. They can do everything right. Sometimes it's biology, man. It's not
it's
an
your
exact
body,
science. Stuff happens. Yeah. And then Micah Parsons, man, that was a very telling for the people who saw it. Like it was like the moment it happened, you're like, oh, I know
you
what just
saw
happened
that.
there.
Yeah.
Yeah. Just to
Yeah,
see
with
it come.
Mahomes, it was kind of weird because he was getting tackled, and then he went to go kind of brace himself with it, and that knee just kind of like a little hyperextended, but you could see that little tibial shift, and I was like, oh, that doesn't look good.
Yeah.
And I texted in one of my group chats of my buddies, like, that does not look like a happy ACL after that. Like, that's not good.
Yeah.
Right.
It wasn't a normal sack.
No.
It wasn't a normal
Yeah.
sack.
No. And then Micah Parsons, I think he made a splash there with the trade going from Dallas to the Packers this year, and then that's a big blow for the Packers.
Huge blow for the Packers.
Going into the playoffs, and that's like top tier defensive player.
Their whole game changed
2 or 3.
after he got traded.
Yeah.
It was like a 1 day good, 1 day bad. Like it was amazing. It was amazing.
Yeah.
Like the worst trade of 2020, 2025.
Right.
Yeah, I mean, it's just not what you want to see for these big names. And there was, unfortunately, I don't have the name on my list here, but also I think the Ravens got hit with an ACL tear too on their defensive side for someone who was like one of their tackle leaders for the year also went
Really?
down. Yeah.
Hate to revel in that. Can't be happy about that.
No, and it's just like crazy how you just get hit with one weekend of all these things where everyone's like, oh, yeah, just, another week of football. But these big names go down, then it's like, oh, this is a big deal.
Right.
Yeah. But the big thing with Micah Parsons is he didn't have surgery yet.
Right.
Right?
Yeah.
So that's more to your point, Steve.
I would imagine it's going to be the more standard.
Right.
And that's
the more standard
and even
approach.
that's more of a, I would say, a generally athletic position where he's pushing a lot more heavier things and moving and being more agile than Mahomes. I mean, Mahomes does have to be agile. He does. He's quasi-mobile as a quarterback, but
I was wondering if we were going to go down this road. Who is it going to? Who does it potentially impact more?
Right.
Yeah.
So why the difference?
Yeah.
And why does it matter?
I would say I think it'll affect Micah Parsons more career-wise and his effectiveness to come back. And I think he's going to come back later. Like, I don't think we see him till, October, November of next year. I mean, he hasn't had surgery yet, so his timer hasn't even started.
Yeah. And then what he needs to do once he does come back.
Yeah.
It's
But
not unheard of.
his ACL only, though.
Yeah, that's what it
That's
seems
a
like.
huge win.
At
if it's
this time,
isolated.
it's only ACL only,
Yeah, and I think you also with that too is, with Mahomes, he might be able to just kind of drop back and be more of a pocket passer and figure it out with his arm, and that could help him and change his game a little bit. And I think he's one of those guys who's gifted enough to do that.
Yeah.
And then as long as the Chiefs kind of put enough pieces around him to help him with that.
Yeah.
I don't know. I feel like they'll have a big.
Don't let him get sacked.
Yeah.
And let him throw the fourth quarter bombs that they're known to do, right? And then he can win every game.
That's it.
Right?
Piece of
Exactly.
cake.
So why can't you do that?
Yeah.
Just set him up next year for that.
I would imagine
Right.
that Kansas City is going to do a lot of shopping on the offensive line going forward, just to make sure he's super protected
He
coming
needs
into
to be
next year.
fully protected.
Yeah.
Right.
Yeah.
I wonder if there was meniscus component to this, it's, especially for Mahomes,
Yeah.
kind of driving it. And like when you watch the way it happened, I got to tell you, the first thing I wouldn't have thought like, oh, LCL2, right
No,
off
I
the bat,
didn't-
in the way that the mechanism, the way that it happened. And I wonder if there's like a misinterpretation, like the information's been out there, but I wonder if there was like a root tear, lateral root tear or something or other, in which case maybe that they felt like, oh, we don't want to wait, let's get in there a little bit more. I don't know. I'm speculating.
This is geeky ortho stuff.
Yeah. It is. It is very much. You're right.
Yep. No, and I mean,
Sorry,
all
I
that's,
busted your
No
balls a
worries.
little
I
bit.
get it for sure. It's how it
but
goes.
I mean, all those little devil in the details. We'll see how that.
Yeah.
I mean,
Yeah.
again, I don't think he's back till October
right.
of next year. I mean, he's going to be back. I don't know, whatever.
Probably.
That is.
I'm
Like,
curious why he had surgery in Dallas. I mean, I know
Yeah.
he's from Texas, right?
Yeah.
That's true as
Well,
well.
that could
He
have been
is from Texas, so I
But
think
even
that
still-
had a play in it. So
He didn't have to. Well, to have it in Texas,
Yeah.
then I get that. But he didn't have to go so quickly.
right,
like,
yeah. And
Unless
there's
he had a
multiple
guy,
pieces
he's like,
that we
just
need
get
to
this
figure
thing
out.
taken care of,
He
right?
may have had a guy. Maybe he
Yeah.
has a guy, a pocket guy that he knows
That he goes to.
that he works
And
with.
I'm not familiar, and I didn't really look it up before. Like, I don't think he has much of a history of surgical surgeries in college or whatever the case
yeah,
was.
Not that we're aware of.
So, I don't know.
Yeah.
Isn't it crazy how the face, like the AFC, is just totally different this year? Like for the first time in a
Yeah.
while, it's like
It's
all.
amazing. I'm only folling the AFC this year.
Yeah.
Oh, is that right?
Amazing.
Really?
Yeah,
Yeah,
because
yeah.
it's unbelievable.
It's
The face
so
is
different.
Totally different.
Yeah.
And then I think, before we kind of close out things here, too, to also bring up Phillip Rivers coming back,
Oh,
which is
my.
another
What a-
person.
What a great.
What the heck, man?
That was
he
great.
was so
I know.
close.
Yeah,
So
yeah.
close to making it work out for
Yeah.
the Colts. And that's another team who kind of went all in. They made a big trades in the
Yeah.
middle of the year.
Yeah.
Sauce Gardner went down with a calf injury not too long ago, and
Right.
I don't think he played this past weekend. But then Daniel Jones, who's having this amazing career-changing year kind of deal.
It was the other leg though, the Achilles,
Yeah.
right? Like
Yeah.
it wasn't the fibula. It
Yeah.
wasn't the same side. Yeah. I mean, unfortunate.
Very
We-
unfortunate.
Yeah. And we'd mentioned the guys are protected
Yeah.
and whatnot, and
Yeah.
this is just nothing to do with that. It's the other side.
But
Like,
then
it's
Phillip Rivers
unfortunate.
coming off the couch to come and play.
Un-
5
Unreal.
years. 5
years out.
Retirement.
5 years.
It's crazy.
Yeah.
Just like,
Isn't
and he
that
went from
crazy?
coaching
high school football.
Yeah.
to going and playing in the NFL, and like you could tell at first he was like, holy cow, like even like I watched a decent chunk of that game of just like,
Yeah.
oh yeah, you could tell he coming up, like
Yeah.
his footwork was all over the place at certain times, and like,
Right.
but I mean he was trying to sling the ball in the places that I was
Yeah.
like, oh that's a tough throw, and he's still trying to do it.
Yeah. Trying to squeeze it in there. That's his whole career, right?
Yeah.
He should be getting up to play pickleball, not
It's like
go
an
back to the
invincible
NFL.
story. It's like
Yeah.
a Mark Wahlberg
Right.
invincible story. Like
Coming
even
out
a
of nowhere.
guy out of
Yeah.
nowhere, out of the
Right.
community.
Yeah.
It's like amazing. It's
Yeah.
amazing.
But I mean, with that being said, I think he also is very lucky that he got out of one game with any injuries. or
Yeah.
any issues. And I
He's
was like,
starting next week.
Yeah,
He's starting again.
Yeah.
Yeah.
And it's like, it's like I jokingly said it before. It's like, well, he's definitely at a very high risk of having an Achilles injury from going from like that
All of it.
typical weekend warrior from
Right.
couch
Yeah.
to playing in the NFL is like a big jump.
You got to imagine, like some guys will stay in shape for a year,
Yeah.
maybe 2 years, like just in
Yeah.
case I get the call 5 years later.
They
Respectfully, he
Nobody's
looked like he was
calling.
retired.
said, no, they said he had an amazing workout
Yeah.
routine.
Really?
Like he really slimmed up.
Yeah.
He was doing like Tom Brady type of stuff.
Yeah.
You know, like Tom Brady does crazy stuff.
Yeah.
Right.
He was doing similar stuff like that. I
Yeah.
mean, he wasn't really. He
No.
played pretty well.
Yeah, he did
honestly.
okay.
I
Like,
thought
yeah,
he played pretty
I was,
well.
but again, I think in that like this is a one of one kind of deal. Like he's
Right.
not. There's no other team other than the Indianapolis Colts that I think he would be able to do this
Right,
with, right?
right.
Like apparently, per what I read, that he was in contact with their coach a bunch because I guess they ran a similar offense in his high school scheme.
Oh.
It's the same kind of offense
Really?
that he's
Yeah.
always ran his
okay.
career.
That's
So
cool.
it's very similar for him
To
just to
step
drop
in, yeah,
in
what
and
was
just
going
know
on.
what's going on.
Yeah.
And then I think again he played for the Colts before. He was there before.
Yeah.
He's the organizational
Well, that's
tie.
Brandon. I think it's a morale booster too
Yeah.
for the city. Like I think just bringing him back, like
Uh-huh.
the history,
Right.
it just boosts the morale, right?
Yeah.
like the Eagles beating the
sure.
Raiders, right?
Yeah.
Like that's a morale boost.
Yeah,
for
need a
us,
tune-up
right?
fight a little bit, you know.
Right, let's get in there. Let's just boost our morale a little
yeah,
bit, boost our
yeah.
egos a little bit. Right?
It's been a rough stretch.
Yeah,
We need something here.
But here, let's take this one.
Yeah.
Right? So I think that's what Indy did, right?
Yeah.
They
And
brought
I
him
mean-
in, they boosted their morale.
Yeah.
Well, Philly brought back Brandon Graham, right?
Yeah,
right.
yeah,
Same idea.
And
Same
Brandon
thing.
Graham had a great game this past
Yeah, he
weekend.
had a
Got
great
2
game.
sacks. He's the oldest person ever in an Eagles uniform to get a sack in a game.
Is that right?
Yeah.
Really?
Yeah, and I
Yeah,
think
it's
he's
crazy.
the oldest person ever to get 2 sacks in a game since like the 60s or something.
Wow.
Which is like,
Yeah.
all right, man. Like that's
Yeah.
what we brought you
He
back
was
for.
on fire.
Yeah.
He was on fire.
Which is again a morale boost.
You gotta prove yourself. Right?
Yeah.
They bring you back. You gotta prove
and then
yourself.
you need a good locker room guy, and there's no one better than BG to do it for
Yeah.
us, for the Eagles at least. So
Well, Maylata's good.
yeah,
Yeah.
Jordan's good.
Yeah.
Jordan's good. But anyway, not to go off topic
No.
too much.
Sure.
No, I think anything else for tonight? I think we kind of touch on everything.
The big ones.
We got all the big ones. Thank you so much for coming on.
Yeah.
Jay.
Yeah,
like this
thank
was,
you for
this was
having
great.
me,
Like
guys.
you know,
this is great.
I
hope to
like the
come
idea
back.
of the other topic that we were.
Yeah, we'll do it we'll do
Little
it in a couple
Dion.
of months or
yeah,
something.
Yeah,
Yeah.
Try to do
Yeah.
some of that.
Yeah, I think we definitely touch on Deion Sanders again with you because that's another crazy story that we talked about for about 5 minutes pre-show, and I was like, holy cow, that's we can dive into that. And that's really crazy.
Deion Sanders had bladder cancer,
Yeah.
and you got to stay tuned to hear the rest.
Good
Yeah.
story. Well done. Well done.
Well said.
I like the teaser.
Well
man.
said.
Thanks, Jay.
So before we go ahead and close out our tab here, we're just going to give a quick shout out to our sponsors, Virtua Orthopedics and Spine. From runners, knee, and dog walkers hip, they have a doc for that. Yardware, back, and laptoppers, they have a doc for that too. Virtua Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. And give a shout out to Neck of the Woods Brewing Company and our guy Brian behind the bar, giving us the best beer in South Jersey. And then lastly, Timber Reel Productions and our guy Kyle, helping us get all this media out to all you folks. So give us a follow and the like on social media, on Instagram and YouTube, and we would appreciate it. See you next time, folks. And if we don't get back behind the microphone before, everyone have a safe holiday break, and we'll see you next time.